for a show of hands, how many people are getting fentanyl-laced heroin in their community? All right, so I guess yesterday we heard a lot of good things about fentanyl, and it is a great drug. But that being said, for a few minutes I'm going to kind of lure you over to the dark side where I seem to live, and to give you a more sinister side of fentanyl. And just to set the stage a little bit of history, back in 2006, the Philadelphia Medical Examiner's Office reported 252 drug-related deaths from fentanyl. So this is fentanyl mixed in with heroin. Most of the cases were occurring in two neighborhoods, Port Richmond and Kensington, which prompted the police to take the unusual step of warning users to stay away. And of course, the effect was they all went flocking here for this great new heroin. And it was bad stuff. I mean, people were ending up dead with syringes still in them. So it was a major problem for us. And this was in the broader context of between 2005 and 2007, the CDC and the DEA identified over 1,000 cases of fentanyl-related deaths. Most of this was being manufactured in clandestine drug labs in Mexico and in California and a few other places. There were very distinct trafficking patterns and very distinct gang ties, which is why it was a very regional outbreak. Some places, and it's sort of the same here, saw a lot of it, and other places saw absolutely none of it. The most heavily impacted was Cook County, Illinois, which is where Chicago is. Philadelphia was number 2nd. Wayne County, Michigan was 3rd, and that's where Detroit is, and Detroit saw 12 deaths in one day from this stuff. Camden, New Jersey, the beautiful town right across the street, right across the Delaware, Philadelphia was seeing it. And also Allegheny County, Pennsylvania. Any Pittsburghers here? Okay. So a little, medium-sized city tucked down the southwest corner of Pennsylvania was getting a lot of this as well. Broader context, fentanyl-laced heroin is not new. Some of you may be old enough to remember China White, which appeared in California back in 1979. It was a fentanyl analog. It was 3-methylfentanyl. Over a period of 5 years, it killed over 100 people. It disappeared or sort of died down for a while, resurfaced in the 80s, and in Allegheny County, Pennsylvania, again, it popped up again between 1987 and 1988, killing 18 people. A little bit of a refresher on fentanyl, it's 80 times as potent as morphine. Duration of action is about 30 minutes, so it lasts about as long as naloxone does. It's reversible with naloxone, and routine lab testing, like drug tests, may miss it. And so generally you need ELISAs or gas chromatography, mass spec to pick it up. And so if you don't look for it, you're not going to find it. And that brings us up to the present. In April of 2013, the Philadelphia Medical Examiner's Office reported death due to acetylfentanyl, another analog of fentanyl. And between May of 2013 and September of that year, the ME's office as well as the Philadelphia office of the DEA reported 6 fentanyl-related deaths. It was mixed in with heroin. It was being sold in packets labeled Flashback and Aldi, and actually had the 4 little Aldi rings on it. But Philadelphia wasn't alone. Rhode Island. The CDC reported 14 overdose deaths due to acetylfentanyl in Rhode Island between March and June of last year. And Providence Journal just reported within the last week that between January 1st and February 20th of 2014, there were 28 fentanyl-related deaths. And back to Pittsburgh again. This is an article from the Pittsburgh Tribune Review from the 27th of January this year. New heroin painkiller mix all over Pittsburgh kills at least 13. Deadliest batch of heroin to hit western Pennsylvania in more than 25 years, meaning dating back to the China White years, killed as many as 13 people just within the last week. It's been sold under the names of Theraflu, Bud Light, Diesel, and others. And once again, obviously, it's affecting Allegheny County, Pennsylvania. In other places, New Orleans area is getting fentanyl-laced heroin. North Carolina, like Fayetteville area around Fort Bragg. Michigan, Maryland, New Jersey, Connecticut. And also for the geography buffs among you, the country of Estonia, which as I point out on that map is kind of the far northeast corner of Europe, has a major fentanyl problem. And in fact, in Estonia in the past few years, fentanyl's been killing more people than car crashes. So if fentanyl-laced heroin shows up in a community near you, what can your community and what can your EMS agency do in response? First of all, you need a robust surveillance capability so that you can even find the fentanyl to begin with. Like I mentioned, it doesn't show up on routine tox screens unless you look for it. And so you're not going to know you've got a problem unless you have a surveillance capability that's going to find it. You can collaborate with law enforcement, with public health agencies, and with the media, both to exchange information and get the word out to the public that the stuff is out there. You can partner with substance abuse prevention programs to educate the users. A few few other things you can do. You can promote community naloxone programs. This is something we've been touching on, we touched on yesterday a little bit. One such organization is in Philadelphia. It's Prevention Point Philadelphia, which among its many other services provides to its users and their families and friends naloxone along with appropriate training for its use. You can allow EMT basics to give naloxone. This is being done as a pilot in Wisconsin and other places as well. Or you can allow your police officers to give nasal naloxone. And this is being done in New Mexico and Massachusetts and other places as well. Anytime fentanyl-laced heroin shows up on the streets, the question of what's the appropriate naloxone dose comes up. And this is a tough one to answer. Just sitting in the back, I did yet another lit search on this. And pretty much the best journal or best study I found on it dates back to 1977. So it's not a hot topic for research. But I found an article in the British Journal of Anesthesia, and what they did was they gave 50 mics of IV fentanyl to anesthetized patients inducing respiratory depression, and then they gave incremental doses of the naloxone, so 0.1, 0.2, and 0.4 milligrams, so not hefty doses, and found that they could reverse respiratory depression in a dose-dependent fashion. And this is consistent with what I found in other anesthesia references, where maybe about 3 micrograms per kilogram of naloxone is about enough to reverse fentanyl. Pennsylvania has statewide protocols like other states do, and so the dosing regimen for naloxone in Pennsylvania is start out with 0.4 milligrams. You can repeat it, titrating it up to a maximum of 2 milligrams. The Maryland Poison Center, and this isn't unique to them, recommends an initial dose of 0.4 milligrams to 2 milligrams. You can repeat it in 2 milligram increments up to a total dose of 10 milligrams. And if there's no response after 10 milligrams, you should think maybe you're not dealing with fentanyl or naloxone or opiates to begin with. Another problem with dosing naloxone is you're never really sure what version of fentanyl you're getting, because there are dozens of fentanyl analogs, and they differ in potencies and their duration of action. For example, there's carfentanil, which is 100 times potent as fentanyl, and it's one of the few agents that's been used in the past to tranquilize rhinos and elephants. And so, if that's a major issue in your neighborhood, that you may be seeing carfentanil in the streets. And there's speculation as well that carfentanil is the agent that the Russian Special Forces used in 2002 to retake the Moscow theater after the Chechens took it over. You may remember this case. There were like 850 hostages. The Russians sort of spookily kind of aerosolized something into the building. Net result was 130 of the hostages ended up dead. But they think that may have been carfentanil. And so from an EMS provider's perspective, you don't know what analog you're dealing with, if at all, and how much of it is actually mixed in with the heroin. So I think the take-home message from that perspective is give the lowest dose needed to restore spontaneous respirations and watch out for withdrawal. Because if you sort of heftily give 10 milligrams right off the bat of naloxone to a chronic heroin user, you're going to have a very unhappy patient. What's that? Oh, really? Excellent. So in summary, fentanyl-laced heroin is back. It's a serious public health threat in some parts of the country, not others. So far, it doesn't seem to be as bad as the outbreak was back in 2006, and hopefully it stays that way. Standard pre-hospital care is probably sufficient for these patients. Higher doses of naloxone may be necessary, but no one really knows the answer to that. And so vigilance, public education, and collaboration with other agencies is key to minimizing the number of deaths. So I'll take any questions.